My name is Jillian York, and I was diagnosed with CLL in the fall of 2017. Like many people, my first reaction was to absolutely panic, but I would advise you not to do that.
When I was diagnosed with CLL, I had no idea what it was. I did know that I felt too young to have any serious disease, and so I panicked. I thought about my children, I thought about their graduating from school, and I thought about their getting married and how I wouldn't be there. And of course, I started to cry, but I knew that that was not going to help me in any way. And I quickly thought about the best strategy in overcoming this.
Hello, my name is Pete Hyde. I'm a leukemia patient and have been on the journey for about 2 years. As I look back on it, there's certain things which I wish I had known, questions which I wish I had asked. So that's why I'm sharing this with you.
I'm Bruce Wright, and I have CLL. I live in Ladera Ranch, California, and I've had CLL since first diagnosed in 2009. I'm currently on my second protocol of treatment.
I was diagnosed with CLL in June of 2014. I was on watch and wait for 17 months and told that when my treatment was needed, the only option was going to be FCR chemotherapy. I had asked my hematologist about genetic testing for 17p deletion or any other abnormalities, and all he ever said was that they don't do further testing until a patient relapses.
After a routine examination for thyroid disease, I was referred to a hematologist and diagnosed with lymphoproliferative disorder, also known in my case as CLL/SLL.
First off, chronic lymphocytic leukemia is a chronic disease. It's not something, I know it's really scary when you first hear the word leukemia, but think about it like having high blood pressure. It's something that you could live with for a long time, and you have time to make decisions.
While I was in treatment, I was reading and learning more about the importance of being tested before treatment. So I made the decision to go for a second opinion as the chemotherapy did not seem to be working. After 6 months of FCR treatments, I got the results back from my FISH test, and I was 17p deleted. Therefore, I had undergone chemotherapy for nothing. I really wish I had not been scared to push further or go for a second opinion sooner.
And the advice I'd like to pass on to you today is learn all you can about your disease. The term I use is own it. Find out everything you can, because below the level of the title of the disease, we are all different with our disease.
Join a CLL-specific support group. 2, do all the research you can. Become your own best advocate. And 3, find a CLL expert.
Joining a CLL support group provided me the opportunity to meet other CLL patients, and although there is diversity in the diagnosis and treatments they're receiving, there are shared experiences. These experiences helped me to become more confident as a self-advocate, receive support and encouragement, and become more informed about treatment options and latest research.
I made the decision to participate in a clinical trial for my frontline CLL/SLL treatment. I used the time between diagnosis and time to treat to educate myself on the, at the time, handful of cutting-edge novel agents being studied. My peers in the CLL Society shared stories of how their lives were saved by participating in early ibrutinib clinical trials, and I wanted to catch the next wave.
First of all, I'm sure you've heard it's really helpful when you go into a doctor's office to have some notes. In getting ready for this, I have a visual aid. I found some notes dated April 15th, 2019. I was fairly new into this entire CLL journey, and I had a lot of questions. I was going to a specialist, and I literally went in with 1.5 pages of notes. I encourage you, when you go to a doctor, be prepared, take your notes, and don't get out of that chair until all of your questions are answered to your satisfaction and to your ability to understand the answers.
What I found was that in the couple of months after I was diagnosed, thanks to being able to access CLL's expert access program, which I was able to utilize as a US citizen who had access to my own medical records, I was able to talk with a specialist and find, that he had a lot of the answers to my questions, and he was able to ease my mind and my mental health. I highly recommend looking at some of the lists that are out there and reaching out to different specialists and finding your own specialist, even if it's somebody that you don't get to see as your regular doctor.
You need to see, not go to all the time, but just touch base with a CLL expert, because they know the latest research. They know what is the latest, greatest thing that's going to keep you alive and get you all better, and even what we should do for COVID.
As you begin to notice some side effects, certainly as you begin to take medication, I said side effects, as you begin to develop symptoms, when you begin taking medication, as you start developing some side effects, that's all going to be very normal. However, a lot can happen. Some people might think I'm a little over the top with this. I'm going to show you something that I found very, very helpful when I dealt with the doctors. I literally went on the computer, I printed off some calendars, and you could see this one was from February 2019. It's pretty full. There was a lot going on. I was taking medications. I was beginning to experience side effects, some very important side effects that I had to communicate to the doctor. And he would say, well, when did you notice the ringing in your ears? Well, occasionally I'm nutty enough, I'd say, hang on, I'll get you the answer. I could literally tell him when.
A few benefits of clinical trials are that you're closely monitored by your oncology care team, and the costly medications are provided at no charge to the patient. My advice is to carefully consider if a clinical trial is right for you when the time comes to treat your CLL/SLL. I'm so glad that I chose the clinical trial route for my frontline treatment.
I will say that the CLL Society has been absolutely astounding in providing me with information. Then their motto is smart patients get smart care, and I'm absolutely a believer in that. It's important to be informed about your particular kind of CLL.
Do what you can to find a CLL specialist. Be your own advocate. Test before treat is incredibly important. It will help determine what treatment will be best and which you should avoid.
So I think that finding some well-rounded approach that allows you to get information from a number of different places and get second opinions is really the right way forward with CLL.
And speak openly about your leukemia. You'd be surprised at the number of people around you who will gather around you to support you. Always have an accountability partner. That's just a big word for someone who could tell you to stop being such a pest with your email.
You have to stay optimistic. You have to have a good presence of mind, stay calm and collected. You have no choice but to be that way for the sake of yourself and your family. And I will also say to stay positive and keep on with your other activities.
I have become active in my treatment plans and thinking ahead with my healthcare team about what treatment options to consider if I happen to relapse. You are your own best advocate. Join a support group, get involved about treatment options, and take on an active role in your care with your healthcare team.
Thank you for listening.